We are at 3 months post-op. Our beautiful young lady's here. She was not sure if she will get the result or not, and I think she got what she wanted.
I think so too.
There you go. So tell patients, remember before you came, you were investigating, you were anxious, you want to make sure you make the right choice. Pretend that you're starting that process again. So now help the other patients understand how you got here, what did you do, how was recovery and everything, and where you are. So just almost like you're talking to yourself before it all happened.
Okay.
Guide yourself.
So I started by doing just a bunch of research, figuring out what it was about my nose that I wanted to change, and then what kind of procedures might exist to help me achieve that. So I did a bunch of research online, and then I ended up looking for doctors in my area who did the kind of procedures that I was looking for. I knew I wanted to take my nostrils in and that my tip was a bit too big. And then I especially looked for doctors who I knew did a lot of work with African American patients. It was important to me that after the procedure was done, that I still looked like I just had a natural nose that fit me and fit my ethnicity. And so I found Dr. Janjua, who was not all that far from where I live in Pennsylvania. And I had a video consultation with him and then an in-person consultation with him. And he just made me feel super confident, super comfortable, and really explained exactly what he was looking to do. I felt like what he wanted to do and what I wanted to have done really aligned. So I just followed all his instructions and came in for my surgery and made sure that I followed all of my pre and post-op obligations, and I think it turned out great.
Wonderful, great. Okay, just showing you a little close-up, as you can see right there. So the tip still is not pointy. It doesn't look like a Caucasian tip. It's very appropriate. But compared to the pre-op pictures, when you look at them, it's a huge
Complete different.
Huge change. And same with the nostrils. They don't look like narrow or anything. But they fit the face now. And it's not like, when you meet, it's like the eyes go straight to the nostrils. And before they did, it's like, oh boy, you couldn't help but notice.
Walk in a room nose first.
Walking in a room nose first. So that used to be the thing. So what I'm so happy that that's not the case, and you can see how it is all nice and subtle, and scars have healed very well. These are tricky with the sebaceous skin that we usually see, but they have healed very nicely. Let's go close as well. There we go. So even with the close-up, you can see they're not bad at all right there. Let's show the scar from below as well, because this was open. Really can't see the scar.
Yeah, it was not noticeable underneath.
Fantastic. Excellent, great. Well, you're a success story, and thank you. It looks fantastic.